Hello, everyone, and welcome. My name is Andrew Spiegel, and I am the chair of the World Patients Alliance. It's really my pleasure to be here today for this important webinar. I'm in Japan. I'm in Tokyo right now, representing the World Patients Alliance. We just wrapped up an important two-day meeting here that we were invited to attend, representing the patient advocacy community, and we are the only organization here representing patient advocates. It was really a great meeting with the having been invited by the World Medical Association, the Japan Medical Association, and the American Medical Association. And I think some great things will come from these meetings. Really excited for the webinar today about patient-centered care and patient engagement. And first, I want to thank our great partner, the International Council of Nurses. They've been really an excellent partner, from participating in our conferences to traveling to our global conference and presenting some amazing data last year in Rome, and now co-presenting this webinar, and we really appreciate our partnership. So today we're going to talk about patient-centered care, put some definitions to that, and patient engagement. We can go to the next slide. As I had mentioned, I'm the board chair and co-founder of the World Patients Alliance, along with my other fellow board members. I've been in the patient advocacy community now for just about 25 years. Next slide. Just a couple opening remarks about the World Patients Alliance. Next slide. We are now by far the world's largest patient organization working across all diseases. And we are an umbrella organization of patients and patient organizations from around the globe. And you could see that from the diverse audience that we have here today. We provide a platform to empower and raise the patient voice. And for those who are not new to us, we have almost monthly webinars at this point on topics that are relevant to our membership. And we know that because we survey our membership every year to ask what they need, and then we deliver on that for the remainder of the year. And that is going to happen again in January. So there's no fees for our member organizations to join. They're all patient advocacy members, or they are associate members. And we are guided by our nine principles that you could find on our website. Next slide. We currently have 467 member organizations with a number of pending applications. And we are from 124 countries that you can see on the map, and it really is a diverse audience. If you look at the bottom there, you have a number of groups from Europe, Americas, Africa, Asia, and Oceania, and really a great geographic distribution of all of our members. Next slide. Today, we're really excited to talk about this topic, and I'm going to very shortly introduce Pamela Cipriano from the International Council of Nurses, the president, and then Lisa is going to do a presentation on patient engagement and patient-centered care. And then I'm going to turn it over to our executive director, our co-founder, our board member, our Superman, is what I call him, Hussein, and he's going to talk about the panel discussion that's going to happen, and then we'll turn it over to that panel. And then we're going to wrap up with key messages and conclusions with Howard Katan, the CEO of the International Council of Nurses. So that's what's on the agenda for today. Next slide. Here's our speakers. Here's our panelists. Next slide. And if you don't speak English, here are instructions. You probably already received these by email, and there are instructions in the chat for how you can listen to more than 43 languages. This is being instantaneously transcribed. And once again, it was just posted again in the chat. So if you need to switch the language, you can go ahead and do that. Next slide. And I thank you. And we have so much to talk about, so I'm going to turn things over. Let's get our first speaker up. Next slide. Pamela, I turn things over to you. Thank you.
Thank you so much, Andrew. I'm pleased to be joining all of you today. And I want to thank the World Patients Alliance for being a great partner as we think about how we can provide better care together for the future. And so it's my pleasure to be coming to you today to share our perspectives, because the partnership between nurses and patients is, again, sort of fundamental. And I think it underscores why our working together with the World Patients Alliance is so important. So if we go to the next slide, it's really clear that the world is focusing now on universal health coverage, and has been, as we're trying to approach the 2030 deadline to truly achieve the major goals around universal health coverage, part of the Sustainable Development Goal 3 around the world. And even though countries will say they have universal health coverage, the impact and the outcomes and the alleviation of debt around healthcare have not been realized. So we know that we can't reach universal health coverage unless we boost the delivery of primary healthcare services. Primary healthcare is inherent to our ability to be able to have person-centered care. It is that one-to-one relationship. It is the front lines and the entry into not only the health system when you have an issue, but really the prevention and care across the life course. And who are the most important individuals in terms of delivering that care? Well, we certainly believe it's nurses. Nurses enjoy that special relationship with all of our patients. And if we go to the next slide, we also can't help but ignore the fact that our attention has been drawn to many global health challenges that may or may not have been present in our lives or really taking up a major focus of the healthcare system until recently, such as the greater emphasis on communicable diseases, as we've seen with the pandemic, increasing numbers of natural disasters and the need for humanitarian care, the stark reminders that climate change are exacerbating many, many health issues, some visible in terms of the floods and earthquakes and things like that, but some less visible in terms of rising temperatures, new diseases that are airborne, changes in our food supply, changes in our water supply. So we have many, many global health challenges, including things like mental health and the aging of population, that really call for us to look at our models of care, to look at how we are joining forces with our patients in an alliance to say, what is it that we need? How do we need to make changes in our healthcare systems to make sure they are being responsive and resilient? Next slide. Let's look at all the drivers for change in today's world. We know that there are many global health priorities, some of which I just mentioned, based on the changes that we're seeing. We also know that one of the principles of universal health coverage is not pushing people into poverty, and so better value for care is critical. We also know that demand is up, and particularly post-pandemic, as people delayed care and were not able to access services. Digital disruption in many places is a very positive force to be able to deliver more care in a more efficient way and be able to make sure that we're monitoring the patient progress, particularly for those with non-communicable diseases. Integrated person-centered care is fundamental. That's what we know everyone is asking for, and that's part of the fundamental belief of how nurses can make a difference. Workforce shortages, though, are really an impediment to making sure that we can provide care where it's needed, when it's needed, in addition to re-strengthening our public health systems so that we're able to anticipate and respond to emergencies. And again, we want to be able to take into concern patient preferences, because we know that the mantra of nothing about me without me has to become real as we identify patient needs. Next slide. So what's happening? We know that nurses, once again, are central to the delivery of care in all settings. And what's important is, as we think about our health systems, we know nurses can do more. We can take on different roles. We can have a broader reach. We can use technology. We have advanced practice nurses that are filling the gap in many countries, as we've seen physician shortages or changes in the distribution of where care is provided. And we also know that many, many countries are providing more education to nurses with specialized knowledge to be able to manage non-communicable diseases. So nurses, in many ways, even though we have these workforce shortages, are responding and stepping up in order to provide better care, more care, and be able to meet current needs. But going to the next slide, we do know that there are, again, some real challenges that we're all working together to make sure that we can address. resource constraints, which are not just nurses, but for everyone. Again, whether it's shortages or trying to get the needed medical supplies at a reasonable cost to people, including medications. I've mentioned specialized education, which we know that many countries are addressing. We have policy barriers, though, that are preventing nurses from working to their full scope. And in many countries, we're saying this is a time to come together to look at how do we optimize each practitioner along the course of the team to be able to provide the maximal amount of care. We also are addressing the social and cultural factors that sometimes keep people from seeking care, particularly mental health care. And then we also know that individuals have problems with the funding models, particularly if they're susceptible to providing the resources themselves. Technological barriers really relate to equity, and so we need to make sure that not only our healthcare workers, but all of our patients are able to access the most available technology platforms that can really help provide more care, such as telehealth. If we go to the next slide, I know you're going to hear more about this from our colleagues in the World Patient Alliance, but we know person-centered care is really important to reduce the fragmentation that we see. And nurses are really key in terms of making sure that the care coordination is being addressed, making sure that patients have information, that they're able to not only get the diagnostic test they need, but get the results and be able to have that follow-up. In the next slide, just recognizing that we have some great advantages if we can only think about moving our current health system to a future-focused system that is on well-being. We're not spending all our money on illness, that patients are activated and engaged, which again, I know is a really important part of our discussion today, because we need to be able to address what really matters. We need to be focused on health promotion. We need to have a much more coordinated and value-based care system. In the next slide, just a mention of one of the great examples that we have in our Caring with Courage series that we've done with BBC Storyworks. This was a great example. It happens to be US based, but it is a clinic that is nurse led, where the individual comes forward and is assessed. And the gentleman who's the focus of this particular scenario basically was using the emergency department for regular visits, where really in reality he needed help with clothing and transportation and food, and really recognizing that his homelessness was contributing to a lot of his health issues. So being able to have wraparound assessment and services by nurses and a care team in collaboration with this patient was critically important. Next slide, another example from British Columbia, that putting together a nurse-run clinic to address pediatric respiratory illness, which we know has been exacerbated as we've seen more airborne asthmatic illnesses occur, particularly with the climate change effects. But we have nurse-led clinics that are leading to many, many cost savings, as well as just much better care for patients. Next slide shows a reduction in amputations. I mean, think about the impact to the individual. A nurse-led clinic being able to change the life of individuals in Tonga by better upfront care and prevention of circulatory problems. Next slide. All this has come together under ICN's agenda called Charter for Change, which is basically saying we want to work with our governments to be able to impact high-level political commitments to better funding, more appropriate funding, not only of their entire healthcare systems, and in particular, primary healthcare, but also recognizing that our workforces need to be supported right now. We need to be able to invest in nursing. We need to be able to look at what's important to have our health systems be more resilient. And we believe nurses are the critical answer as a key provider of services across all venues and settings. We want to be sure, particularly as we've learned through the pandemic, that nurses are valued, that their opinions and their ability to guide changes in health policy is respected, and that we are investing in nurses because we think that's how we're going to be able to return to health. So these are really important times for us to come together as patients and providers, nurses in every setting, in order to be able to realize the goals of health for all and be able to really advance primary care in order to achieve universal health coverage. So last slide is just a thank you, and we look forward to the discussion. We know how important this alliance is, and we appreciate being able to work together and bring these messages to you today.
Well, thank you. That's amazing. The work that you're doing is it's changing the planet. It's amazing work. We know, everybody on this call knows the importance of nurses. We just have to get everybody else in the world to recognize that and start valuing them. Great work. Lisa, why don't you take it away? Tell us about yourself, and then it's your turn.
Okay, thank you. Oh, I have a dog. And there's somebody outside my front window. Sorry about
That's
that.
usually me.
What a great way to start. Jen, shh, shh. Jen. Sorry. My dog actually has a floppy trachea, and that was we chose her because my daughter was born unable to breathe or swallow, and ended up with also having a floppy trachea after years of having a tracheotomy.
Wow.
I want to point out that my daughter got me into the patient advocacy business from broadcasting and marketing because we encountered so many challenges with care over the years, dealing with extraordinary needs. We started with failure to rescue, but I think key in the whole failure to rescue discussion is that there was a rescue. Next slide, please. And the rescue was that a nurse, after 2 hours of not giving my kiddo appropriate oxygenation, came on shift and literally right away in the regular newborn nursery, grabbed my daughter and ran her to the intensive care nursery and saved her life. Normal transport is not in the arms of a nurse running down a hall, but that is what happened, and got her the care that she absolutely desperately needed at that time, and got her the oxygenation that she needed. 2 hours without oxygen has led to a lifetime of neurodevelopmental disability, but we have a healthy, relatively healthy person who is contributing to society 30 years later because of a nurse. We also had in-home nurse care for a number of years as we dealt with a tracheotomy and various surgeries. We've had over 45 surgeries to get that airway working, and really could not have survived without nursing. We love our nurses. We're talking today about patient and family-centered care, and there's 4 key aspects to it, starting with respect and dignity, which I believe is really the most important. It really is viewing the humanity of the other person. We really can't count on the patients always to have the same mindset as we have, but we need to be bringing the patient into the discussion with a sense of their humanity and honoring their wishes, and honoring their family also with them. Another key aspect is information sharing. And I would point out that it's important to give all the information. As we've had our journey, I've often heard that we don't tell people everything because it might scare them. And it's important to assess the actual individual and determine if they can and should have all that information. Usually the answer is yes. People need information in order to make informed decisions. People need to be able to participate in their own care. They need to be able to have the autonomy of their person to make choices and decisions. And that needs to happen at the level they choose. There are people like me that are personalities that like to have control and like to be in on all the decision making. And then there are also people who want all the decisions made for them, and that is okay. It's important to assess which way a person prefers to have that participation go. And finally, collaboration. Collaboration at the point of program development, policy, and information. as healthcare providers, you get so close to what you're doing that you can't always see the impact it's having on the families and the patients. And it's important to get feedback from people who are receiving care, just like any other organization that is healthy receives feedback. In fact, one of the great patient advocates in the United States, in Atlanta, Georgia, is a gentleman by the name of Tausi Wilson, who has been able to provide feedback through his liver transplant and many other issues that his family has faced. But in his professional life, he is a process specialist and has worked with major corporations like Coca-Cola and Delta Airlines. And he offers his expertise to his MedStar Hospital family for free. And it's invaluable. His insights on process have really helped them in shaping some of their practices. Next slide, please. What is patient engagement? And the thing is, everybody seems to have a different definition. I looked through a concordance of definitions and found some harmony in saying that patient engagement promotes mutual accountability and understanding between the patients and healthcare providers. And it's both process and behavior that is shaped by a relationship. And I really think that is the key word. It's a relationship between the patients and the healthcare providers in the environment where they're receiving care. And it's not just where they receive care, but again, it's engagement at the process and policy level, inviting patients into discussions about how care will be delivered. Next slide, please. Factors that impact your engagement include demographic characteristics, how you relate to someone who's just like you versus someone who has a different background, a different culture. Health literacy is a huge problem where people cannot understand the language that is used. There is a tremendous difference in language in English between using the word feces and the word poop, for example. I saw one study that said that pediatricians and pediatric nurses actually had the best communication skills. And I believe that's because they have to communicate with children and therefore communicate at a very understandable level and learn to take really complex medical concepts and express them in simplified terms that patients can understand. Another issue is numeracy or understanding numbers. I've had healthcare providers who didn't understand the difference in micrograms and milligrams in prescribing medication. How do we expect patients to understand those kinds of issues when most people have a strong aversion to anything related to numbers? So understanding numbers in particularly medication management is a real problem and is something that needs to be addressed in how we explain things to people. Finally, power distance. Power distance is an issue of status and authority, and the perception that somebody has of a higher status and authority than you are. And I have often heard from patients that, oh, they can't talk to a nurse because they're so much more important than they are as a patient. And that just is not healthy in terms of healthcare relationships. We want to see an evening of that power distance so communication can occur more freely. And that happens when we find what we have in common. almost all of us can find something that we have in common with another person. It could be that we have children, and children are kind of a universal thing that people have in common. It could be a hobby. It could be a movie that's out recently that we went to see, or it could be a certain food that we like. But finding something in common with another person brings up their humanity and lowers that power distance. Next slide, please. Illness severity. You know, my kiddo was pretty darn sick, but had a healthy mom to advocate for her. When I've been sick, I'm terrible as a patient because I have a really hard time thinking and advocating for myself while experiencing illness, including one of the first rounds of COVID, where I found myself in an emergency room where people were afraid of me and I could hardly even communicate. And I found that people were patronizing me as an old lady who couldn't think very well. It was an interesting situation to be in. And in retrospect, it would have been much better if I'd had an advocate with me. It really highlights the importance of case managers, and like the case that Pam mentioned of the individual where a nurse discovered what they needed. That happens so often. And nurses are really key because they see patients on a longer term basis generally, and they can make those kinds of person-to-person connections. Again, we need to treat all people with dignity and respect. They didn't know when I had COVID and was in the emergency room that I do webinars for an international audience of healthcare providers. They just saw me as an old lady who was sick. And I don't need any special treatment or anything. I just thought it would be interesting to not be called dearie. We need to think in terms of the impact on the family and assess the patient's support. Who do they have to help them? Who's going to take care of them? You should find out who that is. And I want to emphasize that family is not always actually related to each other. I had the most support when I was ill from my next door neighbor, who is a member of my faith congregation, and checked on me daily and made sure I was taken care of. But he's not listed as a family member or a support person. An assessment would have found out I had that. So the knowledge and attitudes of the healthcare professional are also really important in engagement. If you just are interested only in coming to work and punching a clock, healthcare may not be for you. It really is an investment. It really is a life choice and path. And boy, healthcare workers are our patients' heroes in so many ways. To us, we feel like many of you wear capes and should be featured in Marvel movies, no doubt. Next slide, please. It's really important to consider the tasks in the clinical process. And nothing is more scary to a patient than a healthcare provider who doesn't know what they're doing. And if you are among the chronic complex group of patients, you can probably pick up on the fact that a person doesn't know what they're doing. And it's important. My kiddo addressed an audience at the Institute for Healthcare Improvement one time and was asked a question that shouldn't a nurse or a provider try to bluff through or fake knowing something to get through a procedure. And my kiddo said to this very large audience, it's important for you to know what you know. And it's also important for you to know what you don't know and get help. So that is part of what happens to build trust is being honest and transparent about tasks and what is being done in the actual clinical process. It's also helpful to have patients be able to maintain some level of clinical control. Even asking which hand or arm you're going to stick for an IV or a blood poke can make a huge difference to a patient, because then they have some level of control over what is a scary situation. The setting that engagement takes place in is very important. And I can tell you that few people are nearer or dearer to me than the healthcare nurses who stayed in my home every night, almost every night, for over 12 years to take care of my child and make sure that I could get a good night's sleep. They became like family to us and saved my kid's life more than once. So the setting is vitally important to where healthcare takes place. Next slide, please. Engagement considerations. We talked a little bit about transparency. Communication is important. We can teach patients to communicate better, and we need to be more involved with patient education around issues like how patients should describe symptoms. They'll go on and on and on and on and on, and parsing out what is really important can be hard, but we can teach them to do a better job. They need to be taught to identify their priorities, what matters to them. Oftentimes, what patients really want isn't necessarily what we're thinking, and we can simplify everything if we start out with what's important to the patient. We need to talk in terms of education of healthcare professionals. People often communicate with others the way they were communicated when they were growing up as a child in a family. And that may not have been the most effective form of communication for a healthcare worker. So we need to teach that communication and teach them how to have those skills to best engage their patient. And in general, we need to be teaching engagement process so that it goes more smoothly and comes more naturally to both providers and patients. Next slide, please. We need to talk about partnership councils. We talk about collaboration at the policy and program level. That means inviting one or preferably two patients onto things like quality and safety committees where patients can give their feedback. It's important to include patients from a variety of backgrounds. In one of the councils that I served on, we had a question come to us whether or not we should include technology in a parent room for an intensive care setting. And the thought process was everybody has their own technology. Now we don't need to give them computers any longer. The problem is not everybody has their own technology now. Everybody in the world that healthcare providers operate in may have their own technology, but that's not everybody. And when I teach marketing classes, I often point out that by the very fact that you're in the marketing class, you are not in the group of people that you will be marketing to, because most people don't get a higher education. So you need to be able to understand what the needs of all people are. And yes, there are people who don't have technology. They don't have access to the internet. They don't have access to clean water. That is just something that we need to take into consideration as we deliver healthcare. And world situations vary considerably from country to country, but there are still going to be divisions, and it's important to reach out to those people. I talked to one organization once that was working with Native Indigenous people in Alaska and trying to work with them on blood pressure maintenance and control. And their hypertension program actually did not include any of the people they were serving in their program and policy discussions. Once they invited those people in, they learned things that were able to help them deliver care more successfully and develop programs that actually improved the health care received by that Indigenous population. Next slide, please. So I'm so honored to be on the platform today with Pam and the other folks that are here, and I appreciate you taking the time to learn a little tiny bit about patient engagement in patient and family-centered care. This could actually be an entire college degree, or at the very least, a few semesters worth of coursework, and we could delve further into it. But the main thing to take away from this is to respect other people, to communicate well, find common ground, and be proud of yourself for being in such a noble profession. And thank you so much for your time today. Next slide. I want to point out that I have some resources in putting this together, and these are available for you to check out as well. Thank you so much.
Thank you so much. That was not a little bit of information. That was a wealth of information, and I would definitely take your class if you teach it online. Thank you so much. That was amazing. Look at the comments that came in during your presentation. You'll see it very well received. So, keeping on time, I'm going to turn things over to Hussein Jaffe, who is our executive director, and he's also been involved with Alzheimer's Pakistan for many years. He's got decades of experience. Hussein, let me just turn things over right to you.
Thanks, Andy. Can I have the next slide? So I think excellent presentations, excellent beginning of putting the context there. When we started thinking of this webinar, we thought that we need to bring the nurses and patients together on one platform, because sometimes we have different understanding of what person-centered healthcare is or patient-centered healthcare is. Different groups might have different understanding. So I think it's excellent that we could, work towards having a shared understanding of what patient-centered healthcare is. So excellent presentation for us to now start our panel discussion. So we have, an excellent line of panelists here. So let me just introduce them. We have Erica Burton, and she is the senior policy advisor at the ICN. We also have Laurent Chabal. He is the president of WCET. We also have two patients in the panel. One is Regina Kamoga, and she is also a founding director of World Patient Alliance from Uganda, and also Penney Cowan, our founding director, and based in US and worked for decades in the arena of pain. So let me first start by asking, at least one question each to our speakers first. So my first question is to Pamela. Pamela, how do we ensure that patient-centered healthcare or person-centered healthcare includes the voice of patients with nurses and health professionals guiding the way?
This is fundamental to what's really important to understanding the needs of individuals. So I think in part, it means that nurses need to be engaging in conversation with patients to understand what their needs are, how they're responding, how we can be more helpful, and at the same time, encouraging patients to speak up, which in some cultures is very difficult. But I think that's really key. And I think the whole movement for patient advocacy, for patient engagement, is at different stages in different countries. But I think, again, these alliances where there can be sharing among groups is really critical. Usually, patients feel very comfortable talking with nurses and sharing some of their most intimate concerns, some of their questions that they might be afraid to ask their physician or some other highly powerful individual in the system. So it's trying to remove those barriers, providing a safe conversation and a place of comfort that really encourages the individual to speak up and to be able to say what their needs are, or whether their needs are not being met, to hear their concerns and to have that two-way dialogue, because the healthcare workers are not in charge of everything. They are there to make sure that the services meet the needs of individuals, that they're looking out for their safety, that they're providing comprehensive care, and that they are, again, that ally, and in many sense, the protector, whether it's for the clinical condition, the social condition, or the overall welfare of that individual. So it does reinforce the messages that you heard from Lisa about communication, as well as overall advocacy.
Yes, thanks, Pamela. So Lisa, please tell us, how can the health facilities or doctors or nurses, how can they find, families and patients to work with, to partner with in different committees or councils? How can they find these patients?
Well, that is the question we get the most often. And I think it's very interesting that healthcare professionals will sometimes ask, where can we find patients? But the fact is that they're in your facility every day, and the first step is to ask. If you ask patients in general, ask people, put up a poster or a flyer or something that says, are you interested in contributing? One of the ways to find patients who are interested in contributing is to find the patient who complains, but complains with a solution focus. Ask the patient who is saying, this went wrong, but this is how I think you might be able to fix it. And that's the person who's not just complaining because they're a complainer in general, but is complaining with the thought of wanting to make everybody's work and life better. That's who you want. And they're out there. You can bring them in, and I encourage you to do that.
Yeah, thank you. So let's move on to our panelists. And first of all, I would like to invite Laurent, and I would like to know what does patient-centered care actually looks like in practice. So we've heard about the principles of patient-centered healthcare and engagement, and how policy actions and decision making can create models of care that you can put at the center. But how does the patient-centered healthcare actually look like in practice?
I think I agree with what I said before. We, as nurses, we have to recognize that there is part of knowledge and expertise we don't have. And this expertise and this knowledge is in the patient's hands. So we have to ask, we have to assess, we have to look for patients' skills, fears, representation, maybe take also in consideration all the social, economical, psychological, emotional impacts, and probably also the cultural one, as we are in most of our country in a mixed population where people come from all over the world with different kind of backgrounds. We need to take that in consideration in order to create this partnership and be able to build together the care for the best for the patient. Because at the end of the day, it will be to him or to her to deal with his illness, to deal with his treatments, to deal with all the stuff we are telling him to do or not to do in order not to get some complications or not to get some recurrence of what he's going through. And by going step by step, by respect, by clarification, by, really journey together, we will be able to get through that. And for me, that's really the amazing part, because each individual has his way, and we have to find the way to go with him or with her in the best way possible.
Right. You rightly said, I think partnership is the key. And I would, in the end, ask a question to Howard Curtin, our CEO from ICN, that how can patients or the World Patient Alliance or the ICN can work together in promoting patient-centered healthcare in the countries or at the regional level or the international level as well. So since Howard is already switched on his camera, so why don't you answer this one? How can we work together do you think at the international level to promote patient-centered healthcare at the local and national and international levels?
Hussein, I think that we need to be clear in identifying what the barriers are to people and person-centered care. We know that sometimes it can be cultural, it can be old-fashioned paternalistic attitudes and beliefs. Sometimes it can be the way that hospitals and healthcare is organized, very management function, compartmentalizing how tasks are delivered. Sometimes it can be some of the environmental factors that that have been highlighted, lack of technology, issues around shortages. It can be some of the communication barriers, and the lack of health literature, and of course, it can be funding issues as well. And all of those can be very significant barriers to stand in the way of truly effective people and person-centered care. But when we know what the barriers are, that then gives us a window into what we need to be looking at as the sorts of solutions to that. I think the governance around healthcare is key. Are patient and people's voices on governance committees, leadership boards and groups, health and safety groups within hospitals as well? Are you hearing patient stories? How does that inform the quality improvement processes within an organisation? What metrics do you have for quality and for safety? So, things like patient-reported outcome measures as well, which are tracking and telling you. What work do you do when there are safety failures, to investigate and to look at understanding what the causes of problems are as well, and how are we designing our health systems to make sure that people are in charge? As a number of people have said already, the huge opportunities ahead of us for primary healthcare, for universal health coverage, to make our health systems more prevention and public health focused, need a very different approach to the one that we've had in the past. And the approach that they need in the future, without doubt, puts people, patients and nurses in the driving seat. So we should be grabbing and owning that agenda, in my view.
All right. Thank you for highlighting the barriers. But once you're closing this workshop, I would like you to then answer that what role can IC and World Patient Alliance play, considering all the barriers that are around, but at the end of the meeting. So let's move on to patients. So I would now ask Regina Kamoga, why is patient engagement in patient-centered healthcare so important? Why are we here today? What do you think?
It's on mute.
Regina, you mute.
Indeed, patient engagement. We all know that the patient is the only constant in the whole process as they transition from one point of care to another. And as such, they are very critical in this process. And anyone here who has been, and I'm sure we all have been, we know how vulnerable a patient can be, however powerful you might be. And it gets even worse when there are barriers, the vulnerabilities, just as Howard and Lisa have mentioned, and especially where I come from, with patients' vulnerabilities, including poverty, low levels of education, inability to get access to healthcare. All this makes this patient vulnerable. So the need to empower this patient cannot actually be emphasized, to be part of the process, to give them the support, the care that they need to be part of the healthcare process. When my mother was sick, she used to like this one professor who used to, every time she would get into the car to go to hospital, immediately she would feel better. But one day when we went to the doctor. She had a pain before she was diagnosed. The pain she had had for a long time. And when we got to the doctor, my mother asked, "Professor, what's the problem? I have this pain going on for long. Please tell me, what is the problem?" The doctor looked at her arrogantly and said, "I don't know. Believe me, that was, I can say, the end of my mother in terms of seeking care. Because every time we wanted to take her to the doctor, that doesn't know what I'm suffering from, then who knows?" And the impact from then onwards is a story to tell another time. But eventually, through our efforts, my mother was diagnosed with cancer of the liver. But the communication between my mother and the doctor, if only we can communicate better. Patient engagement is very critical in order for patients to be communicated very well, supported when they're sick, and be able to be empowered through the different treatment processes, guided, because they look at the health worker, they look at the doctor as the small god. And especially where I come from, where paternalism is still a big issue, the doctor is a small god. So it is very critical that these patients are engaged so that their needs, their perspectives are all incorporated in the healthcare process, so that they're able to navigate the healthcare system and be able to have health outcomes. Because most of the misdiagnosis, most of the errors, is because the patients are not engaged.
Yes, thanks, Regina. So over to Erica. So Erica, what are some key ways to ensure that patients are involved in inter-professional teamwork?
Thanks so much, Hussein. I just wanted to note as well, in addition to my role at ICN, I also work on the ground as a nurse at a specialty hospital, delivering primary care for people living with and at risk of HIV. And today is also World AIDS Day, so I just wanted to honor those who've lost their lives to AIDS. So in terms of key ways to make sure that patients are involved in the interprofessional teamwork, first of all, interprofessional or team-based care is a cornerstone of patient-centered care. Not one provider or one discipline can provide patient-centered care on their own. So everyone has to be involved. Everyone has to be welcome to participate and encouraged to participate. So that's key. And interdisciplinary care planning, I think, is really important. So that might look like the interdisciplinary or team care meets regularly. Regularly is important. Things change quickly. People's preferences change quickly. They look over the care plan, they review what's gone on, they update it, and they make sure that it's personalized so that it's not just a one approach for one person. So it's really individualized, it's really personalized. And that it does look to meet the needs that are assessed by the team of the patient, but also that are expressed by the patient. So sitting down with the patient as well and with their family and looking at the care plan, looking at exactly what we've written down. Does this meet your needs? Are these in line with your goals? Do these respect your values? And it's really crucial that all team members are there to share information, to identify both medical and non-medical supports and needs, to discuss options, contingency planning, to set goals, and then again, document all of that discussion. And that happens throughout the time that you're engaging with the patient, whether that's over one day or many years. I will say too, I've heard a lot of folks on today's webinar talk about power. So I would really say that if I had to highlight one thing that I do see to patients engaging with the interprofessional team is these power imbalances. So we really need to focus on breaking down power imbalances, breaking down hierarchies. If we're thinking about putting patients at the center of care, we know that we can't have a triangle. We have to have a circle. So when we have a triangle and we have an expert at the top, then they're automatically at the center. And we all know that the person that is traditionally at the top is not the patient. So this sort of subordination, like lots of people talked about, being afraid to not have the information, being afraid to speak up, is a huge barrier to engaging patients in their own care. We know that patients are experts of their own health. Of course, we are experts from health perspective of the science, of the knowledge, of the interventions, but patients are really experts in what health and what well-being means to them, and what their preferences are, and what their goals of care are, and what meets their lives, what works for them, what's going on in their lives. Person-centered care really addresses all areas of a person's life, their relationships, their work, their family, housing, education. And then understanding that some solutions for some are not solutions for all. So some solutions actually may end up harming some people, for example, people who are disadvantaged. So really meeting people where they are at, I think is really critical.
Thanks a lot. So now moving back to another patient, and I'll ask Penney Cowan, what you see the role of nurses in achieving patient-centered healthcare, and how can patients and nurses work together to achieve patient-centered healthcare at local and also at the global level?
What it's really interesting to me is throughout my journey as a patient for many, many years, and more actively recently, unfortunately, nurses are the ones that seem to be there when you need them, to talk to them. They have the time to do it. And one of the things that I think is really important is that a patient sees themselves as in that very passive role, when in fact they need to become an active participant in their healthcare. We need to move them from that passive patient to an active participant. And we need to let them know that, of the whole treatment team that they have, that nurse is going to be there for them. I mean, they're driven, paychecks are good, but they're driven by their passion. And most of those nurses are there because of the passion to want to help other people. I can't tell you how often, doctors come in, they go out, they're very quick, and they have a specific role, and they do it really well. But if you're stuck in the hospital, you're stuck there. And there are both big things, but there's also those little things that just are going to really make things different. And the nurse is going to ask you, what do you need? What is it we can do to help you? And, it's just so important. And to hear Lisa talk about, her role as a caregiver, which I think is also very critical, they have to be part of that treatment team, because a lot of times that person, that patient, is not willing or is afraid or doesn't know how to verbalize what they need or what's wrong with them. Where the family member, they're looking and watching and observing, and maybe can share information that's critical. And again, the nurse is going to engage them in that conversation. They're going to see that they're there all the time. I mean, the whole time I had, was in at one particular point, my husband was there all day. So he saw and he heard. And so he was able to also share things that maybe I wasn't even aware of. So I think caregivers are also very critical. But the whole team comes together because of nurses. And then we heard from Pam about the specialties that they have. So when you get a nurse practitioner for a primary care appointment, it's like you're going to actually be able to have meaningful conversation, because a lot of times providers talk at a level that we don't understand, and we're not going to ask questions because we don't want to look stupid to anybody. So it's important for us to be able to have that communication, but it's also important for healthcare providers to understand that we don't know the same thing they do. And so that language has to be made at a level that we can understand. And I think nurses do that much better. So I know when we started Pain Awareness Month, establishing it in September, we made toolkits for different healthcare providers. I started with nurses. I mean, I call them the worker bees of the healthcare system. They really are the ones that we depend on the most. And again, they're the most passionate. So, I'll stop there because I know we're running out of time. So again, thanks to every nurse that's out there, because I think they really play a critical role in our health.
Thanks, Penny. And I'm thoroughly enjoying the discussion. And I think this needs to be continued, in future as well. And I like this, one of the comments in which it said that we need to have monthly webinars together with patients and nurses. So people are really enjoying it. But since we are running over time, so let's just move forward. Next slide, please. I'm just waiting for the slide to come. Oh.
It's on. It's the save the date for World Congress.
I can see it now. So I just wanted all of you to please, take this down in your diaries. Our second World Patients Conference will be held next year from 19th to 20th of October in Cape Town, South Africa. And I would love to we would love to have all of you to be there and continue this discussion as well. And next slide. So now I would request Howard Curtin, the CEO of ICN, for his concluding remarks. Over to you, Howard.
Hussein, thank you very much. And Hussein, I will try and address your challenge about where we go next, what more we need to do. But just to say, firstly, how much we at ICN hugely value the partnership and the work that we do with the World Patients Alliance. We have, as organizations representing patients and nurses, a very unique and special bond that we are forging closer ties and work together on. And I think that this is a time where we need to be stronger together than we ever have been before. In terms of what we are doing and what we have done, we have come together at global policy events at World Health Assemblies to speak on behalf of patients, to speak on behalf of nurses. I mean, the point of healthcare is to improve the outcome of the health status of people, and patients and the organizations that represent them and nurses can be no stronger or credible or important voice to listen to if you are concerned to ensure that you are delivering outcomes for people. I think, Hussein, we can do more to bring examples of what works and what doesn't. We know from our personal lived experiences of a health issue or at the front line, and we need to make sure that reality, we bring our reality to the center of policy makings. And we need to be clear and show what those outcomes are, the improvements to lives, the ability of people to function in their communities, in their families, to go to work, to engage with socially as well. These are all things that are not only hugely important to individuals, but drive vibrant, healthy societies and communities as well. And these are things that we know are also important for economic growth and prosperity. We need to not be afraid about bringing forward our own policy solutions. The issues around when care breaks down because it isn't coordinated, people fall between the cracks, the frustrations that people have about having to repeat their story endlessly. We know what those problems are. We know how they can be fixed. And lastly, I think that to never forget that healthcare is ultimately about people, and issues of respect, of dignity, of rights, of ensuring their essential humanity one to another is at the heart of what we must together both I think be guardians of and champions for as well. That's what brings and binds us to get together. I think we have a great base in the foundation on which to work on, and through this webinar, huge thanks to all of the speakers for their insights as well. I think that we can be sure that we are going to go forward more strongly together to deliver the types of people and person-centered healthcare systems that we all want to see. Back to you, Hussein.
No, thank you very much, Arden. And next slide. And I think it's a big thank you to everybody. And it was an excellent thing, and I think we will be following up and having more of these such programs together. So we are already over time. So thank you very much for everybody for participating, our speakers and our participants. Thanks a lot.
Thank you, everybody. Bye-bye.